Eric, before we dive, more into the whole issue around, isolation and stress and what it does to your body, can you perhaps, quickly take us through the science of stress? What is stress? How do we define it? What does it actually do to your body? And why is stress such an important factor, uh, you know, well, in people's everyday life, but also particularly for people who are living with some kind of chronic condition or some kind of chronic health problem? What is it about stress that makes it so dangerous?
Well, the vast majority of chronic illnesses are affected directly or at least indirectly by inflammation. And one of the top producers of inflammation is chronic stress. Now,
So,
if
so,
we,
so let's get this straight. When you use the term inflammation, what are we
Mhm.
talking about? What do you mean by inflammation?
Good question. So inflammation is basically an immune response. Most of us will kind of conceive or think about inflammation as, if you hurt your knee, it gets swollen, it gets irritated. That's inflammation. It's a good thing when it happens because it protects us against it getting worse. Same thing, the same immune reaction happens if there's an infection by a pathogen, a virus, or a bacteria. Inflammation is launched to deal and kill that pathogen or to remove the damaged tissue if there's an injury. And once that resolves, that basically takes care of that situation. The problem becomes more problematic when that inflammation response is either too high or too low for an extended period of time. And that's typically when chronic diseases and illnesses develop. And now stress is on the top of the list, I would say, in terms of producing that chronic inflammation state, because it does drive inflammation processes.
And if you give me a specific example, because this is Obesity Canada, we talk about obesity here. So and there's quite a lot of data showing that in fact your fat cells themselves produce a lot of pro-inflammatory factors. So you can actually see that even if you're growing fat cells in a test tube, you can actually show that those fat cells are making molecules that will actually cause systemic inflammation. But when you talk about stress, in that situation, it's someone who's maybe already living in a body where that's producing a lot of these molecules. uh, is there something that we should be knowing about or that we should be aware of that is specific to that situation? So we've got someone living with diabetes, we've got someone living with maybe obesity, maybe chronic arthritis, uh, and then and on top of that, now you've got isolation and you've got all this, as you said, the financial worries, the worries about family, jobs, and all of those other things. So what then happens? Is that, does all of this just come together and everything gets worse, or how do you think about this?
Well, I think it's important that if we talk a little bit about the stress response, then we'll get into how it relates to insulin resistance, weight gain, and inflammation. Basically, the way it works is that when we're faced with a stressor, our brain releases a hormone called corticotropin releasing hormone, and that actually controls inflammation. So on the one half, you have the sympathetic nervous system, which is the gas pedal for the inflammation engine. Okay, and that's commonly known as a fight or flight response. When that happens, that increases inflammation, so we can fight off any stress impact. On the flip side, the brake of it, the brake of that of the engine is the release of cortisol, and cortisol is anti-inflammatory in nature. If you have one single stress event, the gas and the brake are pressed at the same time, so inflammation is controlled and moderated. Unfortunately, if you're under chronic stress, what happens is that cortisol becomes, just like insulin resistant, as any hormone does, it becomes cortisol resistant as well. And that removes the brake from the inflammation engine. So the gas pedal is constantly being pushed. We overproduce inflammation for extended periods of time. And that's what leads to chronic illness. Now, in terms of obesity, metabolic syndrome, diabetes, increased inflammation levels produce insulin resistance, which leads to uptake or increase in adipose tissue. Now, adipose tissue has also been kind of compared to an endocrine organ on its own, because it does produce inflammation products like NF kappa beta, TNF alpha, which are inflammation chemicals. And that feeds back into a loop of inflammation. So you have inflammation, insulin resistance, adipose tissue, and more inflammation. And that's what happens chronically.
Okay.